Hello everyone, and in today's content, I'm going to demonstrate 5 crucial maintenance guidelines you must follow for your penis to guarantee optimal sexual wellness. For those who remain until the conclusion, we'll also discuss a final 6th recommendation as a bonus. These 5 guidelines will essentially outline what every man should practice to prevent STIs, sexually transmitted infections, penile cancer, erectile dysfunction, and Peyronie's disease. By implementing them properly, your sexual health will dramatically enhance, and the benefits extend far beyond just sexual function to your overall confidence and quality of life. The first guideline involves keeping the penis active and avoiding underuse. This principle applies to any body organ, and the scientific reasoning behind it is quite fascinating. The penis, similar to the brain, leg, or arm, requires oxygenation through regular blood flow. It needs to receive oxygen regularly to function effectively and maintain healthy tissue. When penile tissue doesn't receive adequate oxygenation, it can lead to what medical professionals call tissue hypoxia, which gradually compromises erectile function. Here, we're not exclusively discussing sexual activity or masturbation, though these are natural ways to promote circulation. Patients who don't meet these 2 conditions can, for instance, utilize a vacuum penile device or pelvic physiotherapy to encourage erection. These medical devices work by creating negative pressure that draws blood into the penile chambers, mimicking natural erection mechanisms. Pelvic floor exercises, also known as Kegel exercises, strengthen the bulbocavernosus and ischiocavernosus muscles, which are essential for maintaining firm erections and controlling ejaculation. However, a healthy sexual life remains important to stimulate and specifically prevent this underuse, which can compromise your genital organs' function. Research shows that men who maintain regular sexual activity, whether with a partner or through masturbation, typically preserve better erectile function as they age. The second guideline concerns personal cleanliness, and this cannot be overstated in its importance. This remains extremely important, although it might appear obvious, we must emphasize it because the statistics are alarming. Appropriate penis hygiene holds vital significance today, particularly given current global health trends. Brazil ranks among the leading countries in penile cancer incidence, with rates significantly higher than in developed nations where proper hygiene education is more widespread. The primary risk factor for penile cancer is inadequate hygiene, specifically the accumulation of smegma under the foreskin. Smegma is a natural secretion composed of dead skin cells, oils, and moisture that can harbor harmful bacteria and potentially carcinogenic substances if not regularly removed. Therefore, proper cleansing with neutral soap or glycerin soap is essential, as harsh soaps can disrupt the natural pH balance and cause irritation. The ideal approach involves gently retracting the foreskin during bathing, thoroughly cleaning underneath with warm water and mild soap, followed by complete drying to prevent moisture accumulation. Another crucial tip regarding appropriate hygiene involves always cleansing the penis following sexual intercourse because vaginal pH differs from penile pH, typically ranging from 3.8 to 4.5 compared to the penis's more neutral 5.5 to 6. 5. Potentially causing local flora alterations that can lead to infections or inflammation. The third guideline regarding sexual wellness advises men to exercise caution concerning sexual intercourse with partial erection, when the penis exists in a semi-erect condition. This is more common than many men realize and can occur due to anxiety, fatigue, medication side effects, or underlying health conditions. Why this matters is because a penis that's partially flaccid and partially erect becomes susceptible to repeated microtraumas during penetration attempts. The erectile tissue, when not fully engorged, lacks the structural integrity to withstand the mechanical forces involved in sexual activity. These microtraumas can trigger nodule formation within the tunica albuginea, the fibrous covering of the erectile chambers. Over time, these nodules may lead to the curvature we recognize as Peyronie's disease, which affects approximately 3 to 9% of men and can cause significant pain, erectile dysfunction, and psychological distress. The condition involves the formation of fibrous scar tissue that doesn't stretch like normal tissue, causing the penis to bend during erection. Prevention is key, as treatment options, while available, are often complex and may require surgical intervention in severe cases. The fourth guideline, equally important, involves avoiding excessive pornography consumption, and the scientific evidence behind this recommendation is substantial. Excessive pornography can trigger sexual desensitization through what researchers call dopamine dysregulation. The constant exposure to highly stimulating visual content can desensitize the brain's reward pathways, requiring increasingly intense stimulation to achieve the same level of arousal. This neuroplasticity change can manifest as delayed ejaculation, difficulty achieving orgasm with a partner, or erectile dysfunction in real-life sexual situations. Studies have shown that men who consume pornography excessively often develop unrealistic expectations about sexual performance, body image, and sexual practices. The patient becomes dependent on masturbatory stimulation combined with visual pornography, and this compromises their sexual health and performance when engaging in intercourse with another person. The artificial nature of pornographic content, including exaggerated responses, unrealistic body proportions, and scripted scenarios, can create a disconnect between fantasy and reality that interferes with intimate relationships and natural sexual response. The fifth guideline, perhaps the most significant, concerns lifestyle practices, and this encompasses a comprehensive approach to health that directly impacts sexual function. Sexual health directly correlates with healthy lifestyle practices, encompassing both mental health and physical health, including nutrition, hydration, and life habits you maintain. The connection between overall health and sexual function is profound and well documented in medical literature. Cardiovascular health plays a crucial role in erectile function because erections depend on adequate blood flow. Conditions that affect blood vessels, such as atherosclerosis, diabetes, and hypertension, can significantly impact erectile function. Regular exercise improves cardiovascular health, enhances blood flow, and helps maintain healthy testosterone levels. A balanced diet rich in antioxidants, omega-3 fatty acids, and essential nutrients supports vascular health and hormone production. Alcohol consumption and smoking are particular concerns that deserve special attention. Remember, smoking represents a specific risk factor for erectile dysfunction and Peyronie's disease because nicotine constricts blood vessels and reduces blood flow to the penis. The chemicals in tobacco can also damage the endothelial lining of blood vessels, impairing their ability to dilate properly. Chronic alcohol consumption can lead to hormonal imbalances, liver dysfunction, and neurological changes that all negatively impact sexual function. Sleep quality is another often overlooked factor that significantly affects sexual health. During deep sleep, the body produces testosterone and growth hormone, both essential for sexual function and tissue repair. Men who consistently get inadequate sleep often experience reduced testosterone levels and impaired sexual performance. Stress management is equally important, as chronic stress elevates cortisol levels, which can suppress testosterone production and contribute to erectile dysfunction. Now let's proceed to the final recommendation, the bonus guideline, which many people have never encountered, but makes a tremendous difference based on emerging research in sleep medicine and urology. This involves creating the practice of sleeping without underwear or wearing loose underwear, and the scientific rationale is quite compelling. During sleep, men typically experience 3 to 5 episodes of nocturnal penile tumescence, commonly known as morning erections or nocturnal erections. These natural erections serve important physiological functions, including oxygenating penile tissue and maintaining erectile health. However, tight underwear can create compression during these nocturnal erections, potentially causing trauma to the erect penis from restrictive fabric. This type of trauma can create local fibrosis, a process where normal tissue is replaced by scar tissue that lacks elasticity. Over time, this fibrosis can develop into curvature, causing Peyronie's disease or contributing to erectile dysfunction. Additionally, sleeping without underwear helps maintain optimal scrotal temperature, which is crucial for sperm production and overall reproductive health. The testicles function best at temperatures slightly below core body temperature, and tight clothing can interfere with this natural temperature regulation. Improved air circulation also reduces moisture accumulation, decreasing the risk of fungal infections and bacterial overgrowth. These were the 5 simple yet essential maintenance guidelines for healthy sexual life, backed by decades of urological research and clinical experience. The implementation of these practices can significantly reduce your risk of sexual health complications while enhancing your overall quality of life and intimate relationships. If you appreciated the content, please like this video. Share it with others who might benefit from this important health information. You can post your questions below, and see you next time.